your friends, sisters, or mothers. Unfortunately, you may hear more negatives than positives. A woman with an unfavorable birth experience will frequently share her horror story with anyone who will listen, whereas a woman with a positive experience will hold the memory privately with just a few friends and family. The Doctor's Diary. When I meet a woman for the first time and tell her I'm an obstetrician, I almost always hear her birth story. Nearly every description includes details of something that went wrong or was unexpected. I'm pleasantly surprised if she tells me how beautiful her birth was. Even the story of our own birth, as relayed by our mother, unknowingly shapes our views of labor. Inevitably, you will share your story someday with friends, colleagues, and your own daughter. Consider how your description will influence her perspective about childbirth in the future. The shared experience of pregnancy should bond women together and encourage them to be supportive of one another at this important time. Finding a group of women who share your views and beliefs can be invaluable. Childbirth is not a competition in which prizes are awarded to the mother who was able to give birth without an epidural or who pushed out the biggest baby. Sometimes you may feel that any decision you make about your pregnancy can lead to a conversation loaded with judgment. Are you going to have a natural birth? Will you use an epidural? How long are you planning to breastfeed? No matter how you answer or how well thought out your decision, someone, somewhere will tell you that you're doing it wrong. Remember, your choices are ultimately between you, your partner, and your provider. Identify a few close friends to confide in who want the best for you and will support you in your decisions. Childbirth from the home to the hospital. Until the 1900s, childbirth took place in the home. Women commonly labored in an area that was closed off from the rest of the house, surrounded by female family members and friends. They used herbs and drank caudle, a spiced wine, for pain relief and relaxation. As active labor got underway, they were kept warm with the windows closed and candles burning in the room. Once the baby was born, they would remain in this room for a month, being attended by their families. Despite the comfortable environment, childbirth was regarded as dangerous because in those days, many women did not survive. In the United States, prior to 1900, 1 in 1,000 women and 40 in 1,000 babies died during birth. In 1531, an innovative military surgeon, Dr. Ambroise Paré, started a school for midwives in Paris. One of his pupils' wives, Louise Bourgeois, became a well-known midwife to the royal court of France, and in 1609 published an influential book on how to practice the craft. She promoted the idea of letting nature take its course. The time of the birth having arrived, they, midwives, did what their art demanded, which was, the child coming nicely, to reassure friends and family, keep her in a good position, have her eat as appropriate, keep her moderately warm, then help her to use her labor pains to bring everything to a happy conclusion. In the late 1800s, there was a shift in philosophy about childbirth as more men became trained in obstetrics. It wasn't just a field for midwives who had learned their skills as apprentices. It was a science that attracted surgeons. Lying-in hospitals were founded in urban areas, and women would travel there to have their babies delivered by male midwives, or accoucheurs. Birth became separate from family life. The use of life-saving antibiotics and antiseptic solutions became more common. Pain medication was available, and cesareans were a viable option. Dr. Joseph DeLee, who founded the Chicago Lying-In Hospital in 1899, is considered the father of modern obstetrics. Because of the high complication rates in childbirth, he wondered if nature did not intend for women to be used up in the process of reproduction, in a manner analogous to salmon, which die after spawning. He believed that labor should be